Hi, I'm Dr. Tracy Shannon. I'm a neuropsychologist and rehab psychologist at OSU Wexner Medical Center. I have a degree in clinical psychology, but I specialized in neuropsychology. So my first experience working with individuals was working with individuals in a residential facility with severe behavioral disturbance secondary to traumatic brain injury. And I just really fell in love with the population. I've seen individuals on the acute floors, so right after an injury has occurred, and then was able to follow them to the inpatient rehab to track their progress and kind of make recommendations based on where they were in their recovery, and then follow them from an outpatient perspective, doing outpatient neuropsychological assessment to assist with return to school, return to work, really the full continuum of care. So that's kind of how I fell in love with rehab. My role is twofold. In some environments, my role is to kind of evaluate how you're doing from a cognitive perspective. So, are you having memory problems? Are you having attention problems? Have you had change in personality following this brain injury? And how are these impairments, if they're there, how are they serving as barriers? How are they preventing you from doing what you want to do? And I evaluate that, and I can make recommendations. And my other role is more, okay, how can I make these recommendations specific to you? You want to go to college and get a degree in fine arts, but you had a significant stroke. Okay, well, let me look at your strengths. Let me look at your weaknesses. Take what I know about, disability and accommodations in schools, and try to get you those accommodations so you can be successful. And also my role as a psychologist is I want to know how you're doing emotionally. How are you adjusting following stroke? I get to see people get better, and I think that sounds very cliche, but especially, when I worked in pediatrics, and even now that I work predominantly with adults, I would go in and I would see individuals at the very lowest point of their injuries. My role at that point is more with the family, to kind of see how they're doing, how they're adjusting, what do they know about the injury, and make sure that they understand. And then the cool part is to see that person each day go from being unresponsive to maybe giving a thumbs up, to then being able to answer yes/no questions, to then going to rehab and they're tolerating 3 hours of therapy. And it was really pretty cool. So I get to see people at their lowest point make progress and make gains. And I think that's really special.